Thanks, Carl. I appreciate it. As Carl said, my name is Rob Silverman. I'm a Senior Vice President at Booz Allen Hamilton. I focus in the health market with a particular interest in innovation. And we heard some great presentations today. I love when you go to sessions like this and you learn a ton about different parts of the health business, different parts of our area, which we so treasure, which I think is much different than other areas of the country. And we're going to be talking about that through the course of this next session. And we're going to spice things up a little bit, given that we have the much coveted after lunch session. Bobby's taking it easy. She's already got her feet up. Relax. We're going to have some fun with this. So we're going to have a panel come up in a second of leaders from across our ecosystem, federal government, health system space, as well as a representative from an incubator. But first, we're going to have a series of flash briefings. These folks are going to come up and talk to you for 5 minutes, no more than 5 minutes because they get pulled off the stage like it's late night at the Apollo. But they go for 5 minutes, and what our intention is to do is demonstrate a bunch of different health tech innovations that we have the good fortune to have and incubate here in the National Capital area. So without further ado, we'll call up our first speaker, and he's from 10 Pearls. Please.
Hi, good afternoon. Oh, I should talk closer to this. Hi, good afternoon, everybody. My name is Peter Hess, and I am Chief Security Officer at 10 Pearls. 10 Pearls is a product development organization located in Northern Virginia, founded in 2004. We're working alongside leading health organizations, building what we like to call intelligent experiences. You've heard that in the future, technologies like big data, mobile, and artificial intelligence will work together to give people exactly what they need right when they need it. Well, I'm telling you that with the right partners and the right team, that future is here today. It's possible to get these intelligent experiences right now. The first key to intelligent experiences is cognitive design, or designing for how people think. Traditional design has only focused on capturing our vision and attention and helping us with decision making. But as featured in our Chief Experience Officer, John Whalen's upcoming book, intelligent experiences must satisfy all 6 of our minds. Also top of mind, of course, is security. Ransomware is today's hot topic. 10 Pearls is unique in the way that we integrate security and usability throughout the product lifecycle. We have proven that when you combine security and usability, you get better outcomes, better usability, and better security. So the future will be filled with these intelligent experiences, but again, the future is here now. Today I'm going to share with you a story, a very quick story, involving real mobile apps and experiences that 10 Pearls has developed or is still working on, along with some leading health organizations. So we'll start with Tom. Like a lot of millennials, Tom doesn't even remember life without his iPhone. Tom is busy making plans for the weekend when his grandma Joyce calls. Tom is grandma's caregiver. Like a surprising 25% of caregivers are also millennials. Tom's normal group of friends don't really understand what he goes through, but luckily Tom has a community of caregivers. Through an online community and a mobile app, Tom is able to connect with others that are experiencing the same kind of trials and tribulations that he is, through either voice, video, or chat. It sounds like Grandma would like some company, so Tom uses the portal to order a ride and a delicious and nutritious meal to be delivered once he gets there. Tom's online portal can also connect him with experts. Here he is video chatting with the registered nurse to ask her advice. The portal lets him be a more effective caregiver through the online community to uplift him, the advice from experts, and the helpful services, but it's all as easy to use as everything else on his phone. Now, this is Grandma Joyce. Grandma Joyce loves having Tom around, but she knows it's hard on him. She's not afraid of technology, but she wasn't raised with it like Tom was. That's why this new Echo Show device seems like it might be the perfect fit for both their lifestyles. Using only her voice, Joyce can communicate with Tom but she can also get everything else you'd expect from Alexa. She can get the news, the weather, and use this Pinterest-like interface for some tips on keeping healthy. And while she interacts with the virtual assistant, the artificial intelligence in the assistant is keeping tabs on her. It can gauge her mood, her mental state, and even ask her questions to see if she's suffering from dementia. So Tom arrives, followed shortly by the food. Tom checks in with his mobile app, and he sees that Joyce is having a pretty good day, and she's in a good mood. And just then, Tom gets tagged in a social media post. His friend writes, "I just did something in just 2 minutes that could potentially save a life." So intrigued, Tom checks it out. It's a mobile app that simplifies the process of signing up to be an organ donor. It's frictionless, it's tied directly into the national databases, and it potentially can help save a life. So inspired by his friend's actions and knowing that his grandma's in a good mood today, he suggests the two of them sign up together. Grandma Joyce complains that her body isn't worth what it used to be, but she feels much better about herself and they both feel better about themselves once they finish signing up. So Tom and Joyce have had a great day. They don't know anything about security, cognitive design, agile project development. All they know is that the tools they've used today have helped improve their health and their happiness. So the future will be filled with these intelligent experiences, and the team of scientists, engineers, and artists at 10 Pearls look forward to helping you create more of them. Thank you.
Great job. Thank you very much. Next, we have Perthera.
Hi, folks. Good afternoon. My name is Subha Madhavan. I'm the Chief Products Officer at Perthera. We are a cancer precision medicine company. We help patients with cancer receive the best therapy options, and be that clinical trials, off-label therapies, or standard of care therapies. Let me start with the story of Rick Baker. This is a 52-year-old man who was diagnosed with stage 4 pancreatic cancer. He received the Perthera test, the genomic test that we did for him, which actually identified a number of genomic mutations. But one of them was this ROS1 fusion, which led us to recommend a Star Trek II trial for him to be enrolled on this clinical trial. We received this email, and our patient coordinators started crying when they saw this email. I've gone back to work again. I'm traveling. I'm on the beach with my wife, and I've gained 20 pounds. This is the story of patients at Perthera. We help patients with cancer live longer. Let me show you how we do that. This is our PCA process. It's the precision cancer analysis process. We engage the patients from start to finish. We engage the patients right from the beginning when they have their diagnosis, really walking them through the process of how they could get a biopsy of their tumor. We then use a variety of laboratories that are clinical grade genomic test labs, receive that data, and we have an expert engine in the back end that processes all this information, integrates that, and ranks therapies, clinical trials, on-label options and off-label options, and creates a user-friendly report for both their physician as well as for the patient. And we continue to follow these patients to collect outcomes so that we could improve for the next patient who have a very similar profile to really help them with the journeys that our prior patients have had with Perthera. This is the back-end engine that we use. We have deep integrated data from the clinic, molecular information, literature, other big data about trials and drugs. We integrate that into an expert system which has rules and inference engines. And we have human experts. We've got medical review panel experts who look at this information that comes out of the expert system for every case and makes treatment recommendations for their patients. Users can touch our system through our data products, our platforms, as well as the reports. This is our virtual tumor board where the medical review panel comes together and they discuss the case. It's in two parts. One is a chat box, right? So this is almost like a WebEx where they could come together in an asynchronous fashion and discuss a case. And on the right-hand panel is where all the data comes together. So for data geeks like me, I'm more interested on the right-hand panel, but my clinician experts who are on the medical review panel want to have an unstructured chat about each case, making recommendations for their patients. This is an asynchronous one-of-its-kind web-based tumor board that anybody could access from any geographic location, and they don't need to get together in a conference room to be able to discuss a case. We've got experts from many academic medical centers and other cancer facilities who are on our medical review panel to help make recommendations for our patients. This is the report that the medical review panel creates. We list the genomic findings. I showed you Rick Baker's findings, the ROS1 fusion, which led to the clinical trial enrollment. All that is shown here up top. With the genomic findings, we rank the therapy options for each case along with evidence. We have a proprietary scoring model in the back end in our expert system, which ranks and provides evidence as to why we rank these therapies in this particular order. So our whole model is based on democratizing cancer precision medicine. So you don't have to necessarily go to a Georgetown Lombardi Cancer Center or an MD Anderson to receive state-of-the-art molecular medicine in cancer therapy. So we touch patients all across the United States. Our primary customers are advocacy groups. They help us connect with patients and clinicians across the nation so that we could bring that state-of-the-art academic medical center type of precision medicine care to them in their local community. I'll leave you with one chart. This speaks a lot about the types of data and information we're collecting. Data geeks like me call this a Kaplan-Meier survival chart. So what this is showing you is just focus on the green line up top. These are patients who had highly actionable genomic mutation who received the therapy that we recommended to this patient through our virtual tumor board that I just showed you. And these patients have lived much longer compared to the ones that did not have the actionable mutation or did not follow the recommended therapy in our report. So essentially, they received standard of care therapy, and the green line indicates that we've been able to make an impact and move the needle for those patients who received those targeted treatments in the Perthera report. And that's me. Thank you very much. We look forward to connecting with all of you about cancer precision medicine.
Great job, Subha. Thank you very much. Next, we have Avanade.
Good afternoon, everyone. This is Ajay Bawa from Avanade. I work in Avanade as a technology innovation advisor. At Avanade, our vision is to be the leading digital innovator, realizing results for our clients and their customers. We are a Seattle-based company. That is where we are headquartered, but we have a local presence of about 50 consultants spread across the DC area. For the next few minutes, I wanted to talk to you about some of the innovations in the virtual reality and the mixed reality world that we have been exploring and exploiting at Avanade. But before we go into that, let's ask ourselves a few what-if questions, right? Let's imagine and let's ask ourselves a few what-if questions. The first one I have here is that what if we could train our doctors and nurses using 3D holographic images of organs and biological systems instead of a two-dimensional image and a bunch of text in a book? Another one, what if the complete human anatomy curriculum could be transformed from something that is buried in a book to something like this?
We've been teaching human anatomy the same way for 100 years. Students get a cadaver, then they look at medical illustrations, and it's completely two-dimensional, and the human body isn't.
Microsoft HoloLens is a holographic computer that you wear. It enables you to bring your digital world into your real world.
At Case Western Reserve University, we are focused on solving problems and creating new knowledge.
My job is to teach, and I really think this could impact almost everything that we teach people. With HoloLens, you can see the muscles on top of the skeleton all at the same time. You can bring them in and out and exactly understand where things sit.
You can take any anatomical part and show any of it. You can move it around, you can make it kind of translucent so you can see through the outside, and that really helped me understand how cardiac anatomy worked. I actually had a moment where I found the aortic valve, and it was the first time that I'd actually seen the aortic valve in relation to all the other anatomical structures. It was a way of seeing it that you couldn't do with an actual heart.
That was pretty cool, isn't it? So the innovation that you just saw is called the Microsoft HoloLens, a very latest innovation coming out from Microsoft. And this, unlike virtual reality, which is a 100% immersive experience, HoloLens gives you an experience that Microsoft calls as mixed reality. That means they put these holograms, which could be these organs, right in your reality, whether it's an operating room or it's a living room where you're playing with some other holograms in there. So the concept here is that of mixed reality. In the next few slides, I'll walk you through some of the specific innovations that we at Avanade have done using this innovation. The first one is the one where we have explored the use of HoloLens to provide remote assistance to an EMT in the field, like a life and death situation. An EMT is working on a patient, and imagine an expert doctor sitting thousands of miles away or wherever, being able to assist an EMT in the field as if they were sitting in the same room. They're looking at the same thing. They're able to exchange notes, data analysis, test results, everything, in a very three-dimensional oriented collaborative environment. The second example is a virtual reality example, and this is an example where we used virtual reality for stroke rehabilitation. And in this particular example, we combined a virtual reality-based rehab program with a traditional rehab program, which is more exercise-based. And the results have been amazing. Better cognitive abilities, reduced readmission rates, and faster speed to recovery. The third one is more local here. We recently partnered with Virginia Tech. We did App Jam, they called it App Jam. It was basically a hackathon where we challenged the students to ideate and innovate around HoloLens and its impact on the healthcare industry. And the winning team, they got about $3,000 in award money. The winning team was a group of 4 students that came from diverse disciplines like biological sciences, neurosciences, business, and finance. And their idea was to combine a traditional 3D angiogram with a holographic image of a condition known as aneurysm. With this holographic image, you're able to expand, the doctors are able to expand or zoom in and zoom out and walk around the image, and thereby understanding the condition in a much better way and providing personalized care to the patient. So at Avanade, in summary, we've been exploring this innovation in healthcare, in some other industries as well, especially in the healthcare around clinical practice, medical education, as well as biomedicine. And of course, for any further questions, please reach out to me. Thank you. Yep.
Great job, AJ. Thank you very much. Next, we'll have CGI.
Good afternoon. I'm Julie Richards. Can you hear me okay? Excellent. I'm here today to talk a little bit about a story of how FD Cares, the fire department cares, transformed care in their community, resulting in $1 million of cost savings to the healthcare system and 34% reduction in avoidable emergency department visits. But let's first talk about one of their patients, Mrs. Jones. Mrs. Jones is a new patient at an elder care facility. She was just recently released from the hospital with her pain medication, oxycodone. The next day, when she asked for her medication on a more frequent basis than what the staff would allow her, she demanded to be going back to the emergency department. They called 911, and FD Cares came in a cabulance. I'll talk about that later. They came in a cabulance, they looked at her pain medication and her discharge papers from the hospital. They reconciled it and determined she could in fact have that pain medication. They settled her down, gave her that medication, and she agreed to stay and not go to the hospital. But every day, patients like Mrs. Jones are being taken to the hospital avoidably unnecessary. FD Cares, in a traditional care environment, 61% of non-emergent patients are transported to the ED. FD Cares has brought that down by 34% to 27% of non-emergent transports to the ED. Where would you rather be treated? In an emergency department waiting or at home? So FD Cares is a new program established 18 months ago in the Puget Sound fire area. They engaged a registered nurse and a social worker to work with the emergency response team, really in 2 areas. One, to try and do proactive care to reduce those original 911 calls, as well as to help stabilize patients at home and avoid those emergency visits. What they did is they had to pass legislation, actually change legislation to allow the nurse and the social worker to be part of the team. They hired and trained them so that they could work in an emergency environment, and they had to define a whole new set of dispatch codes so the 911 callers would know when to send out this cabulance, a little ambulance, but not quite a big fire truck. They also obtained partners such as the ambulance department, TriMed, 2 of the payers, Premier and Molina, and the local University Valley Medicine Hospital. They generated funding and did a whole bunch of data sharing agreements to try and get this program up and going. So how does analytics fit into all of this? We really need to start looking at this data and thinking about how to use data to prescribe and make better decisions. Stop looking in the past and really going from what has happened, what is the best way to make it happen, what if. They engage CGI to look at 2 key questions. What is the value of this program that they're providing to themselves, but also more importantly to all their partners in the community? And how can they drive further improvements? So we use prescriptive analytics and system modeling, which you can see on the right there, to identify the patient care pathways all the way from the 911 call to the emergency department and start to think about using analytics how we can answer those questions. What if we could direct more patients away from the emergency? Take more to the sobering clinic. What if we could move them to the mental health clinic? What if we could do more proactive care at home? What is the impact? So one of the most challenging parts of the project, of course, was data. We all know that. So this is an actual picture of one of our whiteboarding sessions where we got each of the partners' data. And we'll go back to Mrs. Jones. We needed to identify and map Mrs. Jones in 2 ways. One, we needed to map her as an individual in person across all of the partners. Secondly, we needed to map her episodes of care from each, whether it was related to her pain medication or it was related to her hip replacement. We wanted to make sure that we were looking all at the right kinds of care engagements. So once taking all that data, loading them into the systems model, did some analytics to understand what's the impact of that care. So the one thing that I do want you to take away from this is that if you take innovative care delivery models, you take innovative analytics, you combine them, you too can ignite what FD Cares did. You can have $1 million in reduction in healthcare costs, 34% reduction in unnecessary visits, 783 hours, I'm knocking things down, increased in emergency availability for fire trucks to actually put out fires, and 97% patient satisfaction. Imagine what you can do in your own communities as well by using analytics and human innovative care models. Thank you.
Thanks, Julie. Next, we have Protenus.
Hi, everyone. Is this on? The co-founders of Perthera. My co-founder, Robert Lord, and I were medical students at the Johns Hopkins University before we took a leave of absence to work full-time on our startup. The reason we put our medical careers on hold was because of the increasing number of data breaches in healthcare. As you can see by this graph, over the past decade, the amount of electronic medical records has increased substantially over the past decade. And as a result, the number of people who have access to patient data in electronic format has increased exponentially. So it's become very difficult to understand who is accessing patient data and whether or not they're doing so appropriately. And so while other industries have been able to tamp down privacy breaches, you can see healthcare has not been so fortunate, and it's increased over the past several years. The reason that medical data is so sought after is not just because, as we heard earlier, it's so valuable on the black market, but because of the versatility of the data itself. You can use stolen data for anything from identity theft, prescription fraud, prescription blackmail, or even abusive ad targeting. And the data doesn't change. You can replace your social security card, you can replace your driver's license, but you can't change your medical history. And so even children's records who are stolen out of incidences like the Anthem attack are vulnerable for the rest of their lives. And it's not just the patients that suffer. Hospital systems can be hit anywhere from 6 to 9 digits in damages due to the legal fines and regulatory fees that they need to pay, not to mention the hit to their bottom line due to the brand and reputational damages. So how have we solved this problem? At Protenus, we use an analytical platform that builds profiles about the types of patients who have data in a health system. We take that information from medical records and build information profiles around the types of procedures they receive, the care they receive, and the treatment they're undergoing. We then build profiles on the types of individuals who are accessing clinical data from human resources sets. We then interweave those 2 data sets together using access logs to medical records in order to describe virtually how employees are passing medical records from one to another around normal clinical care. So as a result, we're able to tell with great detail who is accessing medical records and whether or not they're doing so as part of their job function, whether that's clinical or administrative. So the results are that we're able to distinguish between that normal clinical workflow and when someone's entering a record either for snooping or potential data theft as well. Alerts are served up into a beautiful user interface that allows security officers and privacy officers to focus in on tangible, actionable threats rather than just false positives. We've only been around for a little under 2 years, but we've focused working with a number of prestigious organizations that are very forward-thinking when it comes to protecting patient data. To date, we've detected anything from the benign end of the track of snooping into family members' medical records or coworkers' record, to fantasy football enthusiasts looking up their favorite athletes in the medical record to see if they should put them on the bench this year, to individuals suffering from phishing attacks, to people taking Snapchats of celebrities' drug records, to even maliciously downloading extensive amount of medical records for personal or third-party gain. The bottom line is that our solution is able to alert hospital systems before this gets out, and so they're able to tamp down it as it's happened or even prevent it. So we're keeping hospital systems out of the headlines rather than the systems that we're unfortunately hearing more and more about in the news in the recent weeks. So if anyone has any questions, please feel free to reach out. My email, nick@protenus.com. Thanks everyone for your time.
Thanks, Nick. Next, we have Aperiomics.
Good afternoon, everyone. I'm Dr. Crystal Eisenhower, and I'm the CEO for Aperiomics. We are a company that's at the intersection of high-tech and biotech, and we're located here in Northern Virginia. And we have just a small mission. Our mission is simply to save lives by changing everything about how infections are tested. Why is this important? There are millions upon millions of undiagnosed infections right now. The traditional system, up to 75% of infections are never actually diagnosed. Leaving infections undiagnosed creates a huge public health issue. These patients are getting the improper treatments, and they're suffering sometimes decades before they find resolution and answers. And this translates into billions of dollars of lost revenues and lost economic value. Just looking at fungal infections alone, undiagnosed fungal infections cost the U.S. $25 billion annually. So this is a massive, massive problem. And obviously this has a huge global impact. So a reality check. You're thinking chronic infections. It couldn't possibly be that many people living with chronic infections. In DC, we have a 25-year-old man that was one of our patients. For 6 years, his entire adult life, he suffered with a chronic gastrointestinal infection. For 6 years, he passed from doctor to doctor to doctor. For 6 years, he endured treatment after treatment with no resolution in his issue. Fortunately, he went to one of our healthcare providers that offers our service. They collected a fecal sample and sent it to us. In 2 weeks, we identified a parasitic worm that he'd been infected with but never treated for. He's now on the proper treatment and making a full recovery. This is just one example of many of the 150 people we have already helped just since January 1st of this year. The solution that we've developed is called Explore NGS. This is a combination of a biotech solution and a high-tech solution. So on the biology side, we collect a sample, blood, stool, tissue. We have our CLIA-CAP certified lab extract all of the genetic information from that sample. We do a deep whole genome shotgun sequencing approach to get a snapshot of or a blueprint of everything that's present in that sample. And then we do a process called next generation sequencing. This results in a very large, very complex data file, up to 1 terabyte of data for just one patient sample. These are very complex files, and this is the reason why we are the only company in the world that's offering a service that can identify every pathogen from any sample in one test. What our secret sauce is in the data analytics, and this is why I'm here. We can take this very large, very complex data file, and we are able to sort through this information in a way that no one else can. And the end result is a report that goes back to our healthcare providers that lists the microorganisms, every bacteria, every virus, every parasite, and every fungus that we found in that particular sample. This gives the clinicians information they've never before been able to access and is creating a tremendous value to not only the patient, but the healthcare provider itself. A little bit more about the analytics. Our core engine of our analytics, it's built on a different statistical architecture than what other groups are using. It's a Bayesian and an AI approach. We are a modular system, so it's very flexible and adaptable. Our database contains over 33,000 genomes of every microorganism that has been sequenced to date. This is the most comprehensive database of its type, and this is, again, why we can identify every pathogen from any sample in just one test. Our team is a great team of experts in computational biology, bioinformatics, biostatistics. I'm in infectious disease, and we just brought on our sales director in January. We won the Northern Virginia Innovators of the Year in 2016, and we are on the market now. We are on a path to making a real difference in real people's lives. With that, I would love to talk to anyone who has an interest in our technology and our company. I will be around afterwards, so please come find me, and I will explain more about how we do and how we're offering this amazing service. Thank you.
Thanks, Crystal. And for our finale, we have a duo presenting from INF Robotics.
Thank you. My name is Anthony. I'm the CEO and founder of INF Robotics, and we have developed the first in-home automated caregiver service for home care agencies. There are 46 million seniors over the age of 65 right now. 10,000 reach that age each day. That's going to happen for the next 19 years. That's a huge problem. We're going to get to 70 million very quickly. Compounding that problem, we actually have a declining number of caregivers. 90% of seniors want to stay in their home but lack the tools to do so. Currently, this gap is served by home healthcare agencies that actually send a caregiver into the home to conduct everything from companion services all the way to end-of-life care. However, these home care agencies are experiencing a severe problem right now, and that is they cannot find enough caregivers for all the clients that are asking for companion service. And so they are actively turning away customers who want companion service. This is where Rudy comes in. Rudy has two modes of operation. First mode is autonomous mode, where the senior would actually talk to the robot in a very simple interface, robot using sensors and intelligence to know where the senior is and know where things are in the home and navigate the user's home to conduct several tasks. In the remote operation mode, the caregiver can actually take control of the robot, navigate the person's space to conduct risk assessments, and also verify things like medication administration. Rudy can provide adherence to medication by reminding the user of important appointments. Rudy can also provide assistance with carrying objects. Those small tasks to us are really huge for seniors and make a big difference on their daily living. We've also partnered up with Alert One Technologies to provide 24/7 access to an emergency service line in the event it is needed. For the senior themselves, they can actually dance with the robot. It's shown that 75% reduction in the chance of developing dementia happens when you dance. So it's very important for Rudy to be able to dance with a senior. Rudy can also play games with you to keep you not just physically active, but also mentally active, which is very important. And of course, for the 12 million seniors right now that live alone, Rudy's a companion. He actually talks with you, and you can talk back to him, and he'll understand. So what we've done here at INF is we're looping in all the stakeholders within the senior care environment. Before, the patient would just be working with the caregiver, and then the caregiver would have to report back to the home care agency owner. Now the home care agency owner can actually loop in and get more objective data of what's going on. Combined with that, the family members can also take control of Rudy. You can actually pull it up on an app that we've developed, a HIPAA-compliant app that we've developed, and actually take control and move it around. So if mom and dad aren't answering the phone, you can actually get on Rudy and see what's going on. Now, for the senior, actually being a companion and assistant is a huge thing. And we've been piloting at 9 different locations over the past year. We've had a great reception from seniors and home care agencies who actively now want to start selling them to their clients. Seniors love Rudy. As I mentioned, we have been piloting at 9 different locations. These are some brief photos and some brief comments of seniors. We spent a lot of work, not just on the appearance, but overall on the functionality and the feature set over the last 9 locations that we've deployed in. In my closing, I'd like to add that we have developed this product from the ground up. Now, we can actually tailor it to the seniors' needs as they change over time because we have a very modular design. In addition to that, we can also meet the needs of other segments, such as wounded warriors, or even it can work as a risk mitigation tool for hospitals where they can actually deploy this during the 30 days they're responsible for patients when they go home. In summary, we've developed this technology for the purpose of revolutionizing the way seniors age and the way they're taken care of. Thank you.